Prolactin BDI is a dual-action therapeutic pairing the yeast probiotic Saccharomyces boulardii with zinc. While S. boulardii supports gut repair, the addition of zinc provides two clinical advantages. It accelerates diarrhea recovery and introduces localized antimicrobial benefits for the mouth and throat. The clinical value of this pairing is demonstrated in both the speed of gastrointestinal recovery and the expansion of treatment into ENT health. Standard S. boulardii repairs the intestinal mucosa during bouts of acute and antibiotic-associated diarrhea. Findings from a 2024 randomized controlled trial show that supplementing the probiotic with zinc results in significantly faster clinical recovery times in children. In the oral cavity, volatile sulfur compounds, or VSCs, drive the pathogenesis of both halitosis and gingivitis. As powder dissolves on the mucosa, zinc ions bind to and neutralize volatile sulfur compounds. The Cochrane review confirms this localized application inhibits oral biofilms. Disrupting this biofilm turns zinc into an evidence-based intervention for gingivitis. Moving further back into the pharynx, we apply this same logic to upper respiratory tract infections. The combination of topical coating and subsequent systemic absorption of the zinc provides direct support to pharyngeal mucosal immunity. The Himalaya meta-analysis demonstrates that this localized application directly correlates to a measured reduction in both the severity and duration of URTI symptoms. Clinically, this localized immune support translates to the targeted treatment and relief of severe sore throats. Bypassing the capsule delivery method provides the topical contact required for these distinct ENT and dental applications, which are otherwise inaccessible with traditional probiotics. However, direct oral administration introduces a major clinical barrier in pediatrics: severe sensory rejection, resulting in spitouts. This is due to an increased perception threshold, or IPT, which is highly common in sensory-sensitive children. The specific aversive profiles triggering this rejection are the sharp metallic aftertaste of the zinc and the strong yeasty smell of the S. boulardii. Children inherently reject these specific metallic and bitter compounds. Utilizing advanced masking techniques is a biological necessity in pediatric care. The solution is Iprona polyphenol technology. It wraps the active bitter ingredients within a uniform outer matrix, masking the taste. Standardized fruit extracts yield an IPT-optimized lemon flavor that completes the masking process. With the sensory barrier removed, the standard dosing parameters for adults are 1 to 2 sachets taken twice daily. For children and infants over 3 months of age, the standard clinical dose is 1 sachet, twice daily, mixed with room temperature food or water. We are left with a unified clinical tool capable of targeting antibiotic-associated diarrhea, halitosis, URTI, and H. pylori. But this expanded profile comes with an absolute clinical contraindication. This formulation must never be prescribed to patients with a central venous catheter. Because the core ingredient is a live yeast, there is a rare but documented risk of fungemia in severely immunocompromised patients, firmly establishing the boundaries of professional use. You must also monitor for specific drug interactions, primarily concerning oral antifungals like fluconazole or nystatin. The mechanism here is direct. The antifungal medication will neutralize the probiotic yeast, rendering the dose entirely ineffective. There is a secondary interaction to track concerning quinolone and tetracycline antibiotics. High doses of zinc can inadvertently bind to these specific antibiotic classes in the gut, inhibiting their absorption into the bloodstream. To mitigate this, clinicians prescribe a mandatory 2-hour spacing window between the administration of the probiotic and these particular antibiotics. By engineering a sensory-optimized direct oral delivery system, Prolactin BDI successfully transitions basic probiotic therapy into a comprehensive dual-action mucosal defense system.
Just pour a sachet into your mouth, a delicious powder that dissolves in a flash. It tastes so good while it starts to defend, soothing the throat and clearing the air, rebuilding the gut like a hero. One tasty powder, a multi-shield, relieves in a flash. Prolactin BD.